In this video, we will explain how the rapid repair wound dressing works to rapidly repair damaged skin. Skin has three main layers. The outside layer is the epidermis, below that is the dermis, and below the dermis is subcutaneous fat. The dermis consists primarily of the extracellular matrix, made up of collagen fibers, proteoglycans, and other molecules. The collagen fibers are aligned roughly parallel with some cross-linking. These fibers are made up of collagen fibrils, and the fibrils are made up of tropocollagen molecules. In healthy skin, new tropocollagen molecules form fibrils that align and attach to the existing matrix. When skin is damaged, the extracellular matrix is disrupted, and the collagen and other molecules flowing into the wound are unable to align properly, leading to the formation of scar tissue. Some tropocollagen molecules may align with each other, but even a small gap of only 1 millimeter requires more than 70 billion tropocollagen molecules to align to form just one 10 micrometer wide fiber. Hundreds of billions of tropocollagen molecules need to align to form enough collagen fibers to hold the wound closed. The rapid repair wound dressing aims to solve this problem by projecting a fine virtual scaffold into the damaged skin so that the molecules flowing into the wound can align as they would in undamaged skin. This virtual scaffold is produced by tiny magnetic structures within the dressing that imitate physical properties of an intact extracellular matrix. These structures project electromagnetic guidelines into the wound, so the tropocollagen molecules orientate in the same direction, allowing them to rapidly form longer, stronger collagen fibers. This dramatically reduces healing times from weeks to just days and produces a minimal scar. And that's how the rapid repair wound dressing produces faster, better healing.